Hello, I'm Dr. Wanda Torres, MD. I am the founder of Suncoast Women's Care, a medical facility renowned for our expertise in women's reproductive health, obstetrics, minimally invasive surgery, and robotic assisted surgery. Join me each week as I interview guests in the top of their fields about the world of OBGYN, exploring the innovations and personal stories that shape our medical experiences. Hello, I'm Dr. Wanda Torres, and welcome to our serious conversations with our physicians. Today, our guest is Dr. Ariana Tiberi, and she has joined us from all the way from New York. So, welcome, Dr. Ariana Tiberi. And how did you come to Suncoast, and how did you end up here in Florida?
Well, first, thank you for having me. I'm not sure how I ended up in Florida. My dad decided to retire or planning to retire in St. Petersburg, so I haven't lived around my father for a long time since high school, so we decided to make that move. And my husband is from Puerto Rico, so this was a lot closer to his home, and we are both son babies. So yes, this is how I came about deciding to apply for a job with Suncoast.
Well, fantastic. And let me tell you a little bit about the background of Dr. Ariana Tiberi. She has lived all over the world, basically. She grew up in Montreal, and then I think I have it right. She then moved to Switzerland and then Scotland. So just tell me a little bit about that.
Yeah, so I'm glad you didn't ask me where I'm from because I actually don't know the answer to that question. But yeah, I was born in Montreal, Canada, and I lived there until I was 9. And then my dad's work took us to Indianapolis, where I was at an international school speaking mostly French and Spanish, so didn't really feel like I was living in the US. And then we moved to Switzerland, like you said, for high school. And from there, because my parents were staying in Switzerland, I applied to undergrad in the UK and I landed in Edinburgh, Scotland, which has a part of my heart still. And from there, I was undecided what I wanted to do. I was actually applying to do, just like Dr. Malinowska had said, a PhD in neuroscience or at least ALS, neuromuscular deficiency diseases. And then I realized that I didn't want to do bench work and I wanted to deal with patients. So I decided to pursue medicine. And that took me to medical school in the Caribbean, on the island of Grenada. And then from there, I did rest of medical school in New York and did my residency in New York. And then from there, graduated last summer and ended up here in Tampa.
Yes.
Yeah.
So, Dr. Tiberi is one of our physicians that is multilingual, as you heard. So, it helps that she married a Puerto Rican physician as well, because she speaks Spanish very fluently. And of course, growing in Montreal, she speaks French and a little bit of Italian.
Yeah, a few days I would probably understand almost everything, but yes.
Okay, fantastic. So, I always like to know how our physicians or how our, OBGYNs end up doing OBGYNs. So we all rotate in med school. So how did you choose our field?
That is a good question. So I actually had OBGYN last. I was very undecided. I liked almost everything except psychiatry and pediatrics.
Mhm.
Initially, I thought I was going to be a pediatrician, and I spent 1 week, 1 week doing pediatrics, and I knew it wasn't for me, mostly because of the parents. And I did surgery as one of my initial core rotations. Really love the surgical aspect.
Mhm.
I spent some time in the clinic with the surgeon. I just felt like there was that component of patient care and continuity that was missing. And then I did, medicine and emergency medicine. I was kind of undecided. I really liked medicine and gastroenterology. And then I came to OBGYN, one of my very last rotation. So it was very close to the deadline where I had to choose which field I was trying to apply to for residency. And I always think back to one specific encounter I had with, there were a lot of Arabic patients at that one hospital. And as many of you know, most patients from Arabia are Muslim. So, dealing with any type of vulnerable situation, especially unclothed, having a baby with no males present, that's a super vulnerable position for them to be in with a language barrier where they really couldn't speak the language, and neither did the providers obviously speak Arabic. And I was just a medical student, but I really felt a connection to one of my patients, and she just kept looking at me throughout the whole delivery. And it sounds like a sob story, but I always think of that. And I saw her, before and after as well. So I think that really put the nail in the coffin, and the fact that there was surgical component. I could spend all of my days in the operating room, so that really nails it
Say
for me.
this is the most complete specialty out there.
Yes, I totally agree. Yeah.
So, I know that you moved to Florida because you love the sun. So, what things do you like to do? Hobbies and interests?
I like anything that involves being outside. So really anything, like to be active, like to bike ride, play tennis, but picked up pickleball because I guess that's the thing to do here.
Is the thing?
Yeah. Going to the beach, mostly spend my weekends finding a new restaurant, having some nice food and drinks with friends. Yeah.
And I know you like the arts, and we have that in common. We like the arts and we like concerts, etc. So we have plenty of that in the Tampa Bay area.
Yeah. In the short time I've been here, I've definitely been to a few shows. And yeah, it hasn't disappointed as far as much as it has to offer as a city. But I do miss New York food.
Oh yeah, big foodie here. So, do you want our patients to know anything else about you?
Oh, I guess I just want them to know that they can be comfortable with me. I treat all my patients as if they're my sisters and my family.
Mhm.
And I think that's super important. Other than that, like I said, I always like to know a bit about you. So I always ask, what do you do for work, or what are you doing this weekend? Just because I want to get to know, you as my patient. And yeah, that's what I want you to know.
Do you have a favorite procedure that you like to do in the OR? Do you prefer OB, GYN, both 50-50?
It's a good question. Yeah. I think at this point I like them both 50-50. I definitely would never opt to give up obstetric side of things. Maybe eventually, but and I do love the GYN surgical aspect of things. As far as my favorite procedure, I would have used to say laparoscopic myomectomy,
Mhm.
where we remove fibroids. That is one of my favorite surgeries. Yeah.
Okay. Dr. Tiberi is also robotically trained, and she does in office procedures. We have that option for our patients. So we do hysteroscopies in office and ablations, sleep. So I know you enjoy all of those procedures because I've seen you. So those are options that we have for our patients. So can you talk a little bit about your experience with that?
Yeah. So where I came from, where I trained, we didn't have the flexibility or the luxury, I would say, of being able to do those really common, really frequent procedures in office. We had to have the patient do a pre-op visit, go to the operating room under general anesthesia, which has its own risks. And so the fact that since I've joined, I've almost, every month, I don't know, every week at this point, I have in-office procedures. I mean, on a daily basis, we're doing procedures as far as cervical biopsies and biopsies of the skin. We also do a lot of IUD insertions, but bigger procedures like hysteroscopy and, like you said, a LEEP and cone biopsy, those are very nice to be able to do a little bit more in a timely fashion in clinic. And we also have a lot of resources that can help us mitigate pain associated with those procedures, which one of which is our recent addition of nitrous oxide or laughing gas, which has been super nice.
It has been wonderful. The patients want to take that machine with them to their home.
Yes, the patients are woozy and boozy, and they're talking to us, telling us stories, and they're also looking at the screen, and they're able to see their own, inside of the uterus if they want to.
Mhm. Thank you, Dr. Tiberi.
Oh, thank you so much for having me. It was a pleasure.
Oh, well, great. That is a wrap.